We started the Changemakers series as an opportunity to have conversations that lead to large-scale, actionable outcomes, starting with what if as a simple question. And today, it's my pleasure to welcome our guests, Eileen Tanghal and Dr. Tara Bishop, general partners of Black Opal Ventures. Eileen has 20 years of venture capital experience. She has been involved with and sat on the boards of over 40 high-tech startup companies in the US and Europe as a financial venture capitalist, corporate venture capitalist, and on behalf of the US intelligence community. Eileen has served as senior partner and managing director of Incutel, vice president of new business ventures at ARM, and director of Applied Ventures, the venture capital arm of Applied Materials. She started her career as an engineer at PDF Solutions. Now turning to Tara, in her almost 20-year career as a physician executive, she has on-the-ground experience in delivery system improvement, health policy, payer operations, product development, value-based care, and startups. Tara has served as the chief medical officer at Vine, a health insurance startup that is at the forefront of disrupting healthcare. He is also associate clinical professor at Cornell Medical School in New York City. And prior to joining Vine, Tara was medical director and senior expert at McKinsey and associate professor of medicine and healthcare policy at Cornell Medical School. Eileen and Tara, I'm so excited for this conversation. First of all, thank you so much for joining us, and welcome to our Changemakers series. I'd like to dive into it without further ado. You both met 30 years ago while studying at MIT, and from there your careers took you on different professional tracks. Now that you're coming together to launch Black Opal Ventures, I think your unique experiences make you an especially strong investment team. I want you to share with everyone else your respective journeys and how they brought you to where you are today.
First of all, thank you, Pooja and Patience and the entire team at WoWE for the opportunity to tell you about our journeys, how we invest, and the future that we foresee. We're very thrilled to be able to partner with you and excited for the impact that many of these companies will be having on healthcare and more broadly. So I'll kick it off with a little bit of my background. And as you mentioned, Pooja, Eileen and I have known each other for over 30 years. We met when we were undergraduates at MIT in the early 1990s. I now have a child that just started college, and I joke with him that when we started college, there was no internet, which sometimes blows his mind. But that was a day and age when we started university. We were both engineering students, worked very closely together, both academically and in extracurricular activities. And we've had sort of two different career paths. I have had a career path in healthcare. Eileen has had a career path in technology and venture capital. And we find that those two career paths are really important because it allows us to bring two different things to the table when we think about investing and we think about the potential for our fund. So quickly about my career path. So I started my career in healthcare right after undergrad. I went to medical school and trained as an internal medicine physician at Mount Sinai Medical Center in New York City. I've actually lived and practiced in New York my entire career. And just kind of thinking back to sort of the early days of healthcare at the time when I started training, this was in 2002, nothing in healthcare was digitized. I actually joke that I used to spend most of my time as an intern running around the hospital and trying to find charts and read doctors' handwriting because that's how healthcare was practiced. And it was really around that time that I sort of said to myself, I could go and practice, I can, specialize, I can do anything really. But in fact, I feel like I'm working in a completely broken system. And that's been sort of an underlying theme of my career is trying to find ways to improve healthcare and solve the very challenging problems of healthcare. That career path has taken me on a very wavy career path, not typical for a doctor. And it's been a career path that hasn't really had a playbook. but has had, I think, a lot of impact, and I think potential for impact, particularly through the newest phase of that career, which is Black Opal Ventures. So after medical school and training as a resident, I joined academic medicine, was a professor at Cornell Medical School. I still hold a faculty appointment there, and we spend quite a bit of time with the medical school. But did a lot of work in health policy, in delivery of care, and saw patients in primary care practice and in the hospital. That was an amazing time of my career. But I was also looking for something, after spending a number of years in academia, that was a little bit more on the ground and hands-on. And I had an opportunity to join McKinsey, which is a global consulting company that was doing a lot of work in value-based care. This was a time after the Affordable Care Act where things were really shifting in the way we were delivering care and paying for care. And many large organizations, whether they were payers or providers, needed to find ways to succeed in this new landscape. And McKinsey was doing a lot of work with those clients. So I joined as a medical director, worked with a lot of groups that were doing value-based care transformations. And that was really the time where I sort of saw a whole different side of healthcare that, to be honest, I didn't know much about. It was a private side of healthcare. It was the business side of healthcare. And it was a side that actually really got me excited, and I had a lot of interest and fun in. Moved over to the startup scene, and you'll hear Eileen and I both have had startup experience. Worked at a very early phase, fast-paced startup as a chief medical officer. I remember the early days of that startup where many of us just rolled up our sleeves and did a lot of everything, to scaling that company to an eventual exit of that company to a large payer organization. And then launched Black Opal with my good friend and my colleague Eileen, who I'll turn it over to, who can tell you a little bit about her background and how we got started.
Yeah, thanks so much. And thanks again, Pooja and Patience, for having us. I have to say, we haven't known each other very long, but the impact you've made on us and kind of the fund at hand has really been tremendous. So thank you so much for having us. Yeah, so a little bit about myself. I've been sort of hanging on to this phrase, mostly because I once worked with the son of John le Carré, who wrote Tinker, Tailor, Soldier, Spy. And I've been sort of summarizing my career with a similar phrase, which is engineer, VC, mother, spy, but spy not really. And I'll explain kind of the different phases of my career and how we got here. So as Tara mentioned, the first part, engineer. I studied electrical engineering, computer science at MIT. After that, went into a startup company. There were just 6 of us. And that company went from being just 6 of us to going public. So had a very early success in a VC-backed startup. Moving on then to VC. I went to business school in London in the early 2000s. And actually, a lot of people ask me, well, how did you get into VC from there? I have to say it was a complete fluke. I was shortlisted, went into a VC firm. They started asking me a bunch of questions. I was an engineer and I knew something about semiconductors and specifically the mobility of electrons in silicon. And that pretty much made me different to everybody else that was interviewing. And that's why I got the job, in all honesty. So I went from being an engineer to a VC. Then while I was a VC, I went from being a financial VC to running the venture capital fund of Applied Materials, having my child, which is the mother part, which is so important. Why venture capital is actually a great career choice for women, because you can balance being a VC and being a mom. And then finally the spy part, and spy not really, which is of course being a venture capitalist on behalf of the CIA, NSA, and the defense and intelligence community. So that's been my career. Now, how did we get here? Now, while I was I've had this 20-year career as being a venture capitalist, and I will say I've sat on 40-some boards, and about 90% of them I am the only female, and sometimes the only person of color as well. So a twofer, as they say, which is sad, but that's been the reality. And this is because these are our tech VC companies, majority white male, and I'm sitting in the Valley. Now, my entire career, you'll see I've always tried to get more women involved with venture capital, whether it be sitting on the boards, um, just trying to get into the industry, recruiting them as associates, as an analyst, et cetera. But in 2019, starts the journey of Black Opal. Myself, Tara, about 6 of our other MIT friends were sitting around in Switzerland, um, at one of our other friends. We were visiting her because she's now heading up all of Merck's oncology group inside of Switzerland. And we were talking to each other and saying, gosh, we've been working for 20 some years. What's the next thing we should do? And Olav said, okay, well, why don't we start a business? And after a lot of kind of hems and haws about what to do, we sort of went away and didn't really have an idea. And then the following week, I kind of said to myself, I was sitting honestly on a board meeting for one of these deep tech startup companies, a GPU company, all guys on the board, and we were talking about this company going for a SPAC. Now, if you guys know, in California, to go for a SPAC, you need to have a woman on the board. Okay, so here we go. Does anybody know any women on the board? This is honestly what was happening. I don't know. Do you know any women? I mean, this is going on. And the guys all came with the same woman because apparently that's the only person they know. One woman could possibly put on this board to go SPAC. And I said to myself, this is incredible. I realized something, which is the networks between these guys and the possibilities of people on these boards is really not very large. And so I said, okay, I'm an engineer. I like to fix things. Let's try to fix this. It turns out I have all these super accomplished women in healthcare and life sciences. And the company was trying to go after this market in my network. So I'm going to start bridging these people together. So I call up Tara. I say, I think, you start helping out on these companies that they need assistance. And that sort of, morphed into what we then called Phi Altus. So we said, why don't we invest our own money? And Phi Altus actually stands for sisterhood. Phi is like brotherhood or sisterhood, and Altus is like a hill. Mountain, because we were climbing up this mountain. It's not a mountain, a hill in Switzerland, because there was a tree line. We've been told it's not a mountain, but it's a hill. So we started that way. We were seed investing at this collision of tech and healthcare, and got the opportunity about a year later to develop this idea from being, a seed investing from ourselves, trying to bridge tech and healthcare, trying to bring more women into venture capital, into what you see today, which is Black Opal, backed by a number of impact investors who are trying to change the game in venture capital, who are on this journey with us, like yourselves. So that's really how it is. I think there's some more drama to where we got to, but it started with we got to solve this problem. It cannot continue this being with not enough women in venture capital on these boards, developing the technology of tomorrow, which is going to affect all of us.
Thanks, Eileen. Thanks, Tara. I always am so fascinated to hear about your background and in awe of both of you. Let's talk a little bit more about your fund, because I think it has a very unique strategy. Your focus is on the nexus of healthcare and technology. So let's dive a little bit deeper into that. You have a thesis of translating technology that's been successful in other industries and applying that to healthcare to really disrupt this healthcare and life sciences. So I want to know more about the trends that you've seen that support this as an investable thesis.
Yes. So one of the things that we've observed both in both of our careers, both on the healthcare side and the tech side, is in fact, when you find companies that are really transformative and really changing an industry, often it comes from either outsiders or a collision of two industries. Some of the examples we can often think of are things like Tesla or Illumina, companies that have really transformed industries and but really bring together two different kinds of ways of thinking about things. And Eileen and I, we talked a little bit about sort of the early days of why we started investing together. We were seeing this actually happening from two sides. So I came from the healthcare side. I was working at a very early phase, fast-paced startup, and we were trying to use data and analytics and artificial intelligence to really change the underwriting model of health insurance. And yet I felt like I was actually sitting at night on spreadsheets, kind of manually coding things and giving it to our tech teams and our underwriting teams. And I remember sort of texting Eileen and saying, isn't there a better way to do this? Like, I can't believe this is how we're like organizing data. On the flip side, Eileen was working with a number of high tech companies that really wanted to get into healthcare, but they had no idea, or it was very difficult to navigate what is a very complicated system of understanding the value proposition for customers, and how to work with these healthcare organizations. And that was sort of where we had this aha moment and said, we really need to bridge these two industries. We know that if you actually can bridge industries, that's when you see transformative, highly industry transformative companies. And that's really what we want to go after. So what we actually decided was we want to we actually focus on 4 areas for the thesis of our fund. So an underlying thesis is just a collision of 2 industries, so highly technical solutions where we're really bringing sort of the future of technology into healthcare, and companies that really do sell into healthcare. So not tech just for the sake of tech, but tech that's really, really selling into healthcare system and changing the healthcare system. And there's 4 areas that we focus on for the fund. 3 of them really focus on the typical patient journey, and then one of them focuses on the underlying thesis of the value of data in healthcare. We call it the 4D strategy. It's our acronym for keeping track of this strategy. But the Ds are the first is diagnosis and prevention. So how can we use technology to actually prevent disease before the onset or diagnose disease before it becomes too late? You can think of examples like cancer or cognitive decline and dementia. If we can actually capture those diagnoses or prevent those diseases from happening before they start, we can have transformative impact on outcomes and quality of life for people. The second is around delivery of care. And when we think about delivery of care, it may be how you might improve the way you see a doctor. It may also be the way we pay for care or the administrative burden that happens in healthcare. And so we're looking for companies that are building the future of delivery of care, to improve access, to lower cost of care, and to improve quality of care. The third is around the life cycle of treatment. So drug discovery, development, and really personalization of care. So how do we actually lower the cost and the time to get drugs into market? How do we then get the right treatments to the right patient at the right time? And how do we actually just streamline that process of development to delivery? And then, as I said, the last D is focus on data and analytics. We have a thesis around the value of data. About 30% of the world's data is actually healthcare data. And yet we tap into so very little of that. And, in the past year, we've seen this power of artificial intelligence, the power of data. It's been sort of something that's bubbling up, but really exploded in 2023 for many industries. And so the last area that we focus on is enabling technologies for unlocking that data, whether it is technologies that are using databases or developing databases that are software companies that really allow healthcare to unlock the power of data. And Eileen has been investing in many of these areas for a long time and has been following sort of the tech trends that are really that will be shaping the future of healthcare. So Eileen, I don't know if you want to talk about the key technologies that we're seeing at the forefront of this change.
Yes, thanks, Tara. So we like to say we invest in the 4Ds underlined by 3 C's and an A, right? So that MIT geeks like these letters, normally numbers, but confusing letters in this case. So 4Ds, 3 C's and an A. So what are those 3 C's and an A, or 2 C's and an A that we like? So if we look at kind of where is tech gone and where is it going? When Tara and I were younger, we actually had our first Commodore 64s. I don't know if some of you had that. So we were kind of the first people with those first computers. And really, if you look at the history of compute, it's gone from being those mainframe computers in the back to these PCs that Tara and I were, programming when we were little, to back to cloud computing, and then finally what's going on now, which is edge computing. And this is really exciting for us. So we're looking at companies that are leveraging edge computing, meaning you can do, you have it on your mobile phone now, right? This is more powerful than any of those mainframe computers in back then. But now you have it in your ears, on your wrist, all over your body. And what does that mean for healthcare, right? You can do real-time monitoring, diagnostics, and eventually maybe even treatment, just because of the power of compute that's happened with the miniaturization electronics. The next thing we're looking at is the advent of next generation connectivity. When we were in college, we didn't have cell phones, right? I mean, this has been like 1G is GPRS. And you can see every time big changes happen in every industry, it is when there is a leap from a generation of comms, from 1G to 2G to 3G to the iPhone. iPhone is from 2G to 3G to 4G. We're in 5G right now. We're about to go to 6G. And when we do that, again, the number of devices, the wearables, the things around you, this true immersion computing, IoT computing, like the stuff of Star Trek, which I love, by the way, is really going to happen. That kind of next generation is going to be 100x more devices, 100 more x more connectivity. And then finally, and Tara has mentioned, this is the last A, which is AI. So, when I was investing at InQtel 6 years ago, AI sort of, infancy stages, you are still doing things by kind of looking at specific images and cats and trying to train the AI to figure it out. And it's not really generating anything. I think you saw at the beginning of the year, obviously, with generative AI, it's completely game changing. This is like when the internet was starting. Again, Tara and I were the first folks to use the internet browsers at MIT. The Mosaic browser, we were the first class to have that. And when we saw the generative AI come out, it was sort of like that same moment, 25 years ago happening again, or actually 28 years ago happening again. So generative AI, this is what we're looking at. It has the power to really transform healthcare. We are already seeing that from one of our portfolio companies called Hyro. So that's our thesis: 4 Ds, 2 Cs, and an A.
Thank you. I love the mnemonic, the acronym to help remember. And I can definitely see the potential for financial and impact returns that your thesis can provide. To dive a little bit deeper into the impact thesis, I know that there are transformational benefits that Black Opal Ventures investments are having on health equity. Sarah, can you share a little bit more about this, and in the interest of time, just provide one example from your portfolio?
Yeah, absolutely. So, as I mentioned earlier, I've been in healthcare a long time, and, the problems in healthcare 20 years ago, sadly, still exist now. I think we've had incremental changes and improvements in things, but we still have a lot of problems still in healthcare. And when, there's probably a few things that we strive through, just sort of agreed upon nationally and internationally as a healthcare system, both in the U.S. and globally. But what we're looking for is a healthcare system that provides high quality care, that is accessible to all, and at a price and a cost that's reasonable. So if you think of that as like the 3 things that we're aiming for, and that's been called the triple aim in healthcare. A fourth part of that is actually health equity, so fairness across the healthcare system. Those are all things that we've been trying to accomplish since I have been in healthcare. And there are 4 things that we really are trying to accomplish through the investments in our fund. And the one thing is that it's very challenging, right? So these are challenges that have been sort of difficult for both the U.S. and globally for us to achieve, but they're really, really important. For example, take health equity. If you actually look at some of the data on health equity, it's really sort of it's sort of mind-boggling that we live in a world, in a country where there's such disparities of care. For example, in the U.S., a woman who is Black is more than 2 times as likely to die from during pregnancy or during childbirth than a non-Black woman. We also see that that children who are adolescents who are part of the LGBTQ community actually have more than double the rates of suicide and mental health issues than their counterpart adolescents, and even illnesses like cancer, where we know a lot of the biology and we know a lot of the reasons for illnesses. Despite having similar prevalences, Black people who are diagnosed with cancer are more likely to die from cancer than their white counterparts. So we know that these problems do exist. And things like access to care, quality of care, we know that there are disparities in the healthcare system. So some of the things that we often get asked is like, well, what can technology do to actually address that? Is tech really a solution there? And I'm actually a very firm believer that the technology is actually the way that we will start to address many of these healthcare issues. Access, quality, cost, and equity. Technology, for example, allows us to be able to deliver care to rural populations or underserved populations that may not have access, for example, to a highly specialized person, but could have access to them through a remote or virtual means. Or it allows us to actually personalize care so that we're actually delivering the best cancer treatment for a patient based on their genetics, based on their race, their ethnicity, their gender. That's very different than we could have done 10 years ago. So as much as technology feels like it may be something that's only accessible to perhaps richer nations or richer populations, in fact, it can be a big equalizer in many industries. One of the examples that I like to bring up is actually a company that uses artificial intelligence for predicting whether someone may be at risk for developing lung cancer. So lung cancer is actually the biggest killer in the world in terms of cancer. It has a higher mortality rate than breast cancer, colon cancer, prostate cancer combined. And yet we often will diagnose patients very late in their journeys when there isn't really effective treatments. And we invested in a company called Optellum that actually uses artificial intelligence to be able to predict some of the earliest signs of lung cancer for someone who may be having radiology studies. It's the only FDA-approved lung cancer detection model, and it's a good example of how really highly technical solution is actually improving access to highly specialized knowledge. If you think about what a radiologist does every day, they look at scans, they have to make a determination of whether something on a scan looks worrisome to warrant further treatment and diagnosis. But if you're a radiologist who may be working and reviewing hundreds of films a day, or working in an area where you're seeing many different types of films and you don't have that specialized knowledge, artificial intelligence and a product like Optellum's lung cancer prediction can actually even out that playing ground so that you actually get the same kind of care that you may get from an academic medical center at a rural healthcare center. And so that's sort of the power of technology that's impacting a highly deadly disease, and can really even out that playing field. So those are the kinds of companies we're excited about, and the intersection of tech that we think can be very valuable.
Thank you, Tara, for sharing that example. Very fascinating. I would like to dive a little bit more into gender diversity in venture capital. First, to share a few statistics, we see gender balance teams in venture capital at the entry level, but women only represent 16% of all VC decision-making positions in the US. But we also see that female VC partners are 2x more likely than their male VC counterparts to invest into female-founded startups. And VC firms that increase the number of female partners by 10% experienced a 1.5% increase in fund returns this year, and 9.7% of their exits were more profitable. Eileen, you've been in the technology and venture capital industry for 2 decades, and have you seen the industry change with respect to gender diversity? What more do you think needs to happen to get more women in VC leadership?
So I think that really there's the demand side and the supply side. So on the demand side, I think, what I think was really exciting is the legislation that was passed on October 9th in California, requiring venture capital funds to report the diversity of the people in which they invested. So the first is, let's hold these asset allocators accountable to us as people giving them our money as to where they are investing. Are they investing all of our money in our pension funds, in our retirement funds, in our investment funds, only in specifically white male-led funds? And do they really think that that's the best way to get alpha? Probably not, right? So in order to get more women in, you need the people who are allocating the capital to demand more diversity within the groups in which they're investing. So that's one, and that's fine. If the demand is there, that will help. Now, on the supply side, we need more women into venture capital. Now, we at Black Opal are doing this a couple ways. One is, we have a Black Opal Venture Fellows program in which we recruit women and minorities to be part of, so that we can teach them about venture capital, because to be a venture capitalist in many ways is an apprenticeship. You need to, source, lead, do the deals, exit, and learn the business. So I think, on the supply side, there are forums like this where, like Black Opal Ventures Fellows, where you can actually learn. The other way is exactly what you all are doing, Pooja, which is to get women to invest in venture capital firms. Because if they do that, then they'll at least understand what we look at, how things are done, what we analyze, the portfolio companies, get themselves into the networks, that kind of thing. So I think that's really what needs to be, on the supply and demand side. Finally, I think it's really important to be a bridge, right? Now, one of the things, and again, I've been in this network for a long time, right? And what you don't want is to alienate the people that are there, right? And who is there are white male tech guys. That's who's there. And if you kind of alienate them, they're not going to bring you into the world of venture capital investing. So, we're successful in that. These are the guys that we went to college with for a long time. So we sort of understand how to navigate both worlds, how to kind of not feel threatening to them and to the positions that they hold, and not make them feel like when we're pushing that we're trying to push them out of the way, right? We're trying to bridge and add value to what's going on. So supply side, yes, let's develop more women. Demand side, yes, let's demand that there are more women. But let's also not alienate the people that are there, and be a bridge to them so that we can all do this together.
Yeah, wise words, Eileen. This is not a zero-sum game, for sure. And, I want to double click on the role of women as limited partners here in the ecosystem. And we at WoWE, we're very excited to be LPs in Black Opal Ventures and play that catalytic role in introducing our network of female investors to funds like Black Opal Ventures, so they can co-invest alongside us. And I think this is particularly important for you both to have that level of diversity in your LP base, in addition to your focus on who you're funding in terms of the entrepreneurs. So Eileen, a question for you is, what have you seen to be the implications of the lack of women as LPs, and the opportunities for the VC ecosystem to get more women into roles as asset allocators and as LPs for both Black Opal and the broader VC ecosystem?
Yes. So I think, the implications are when you don't have certain groups represented, you're going to have bias, right? I can give you so many examples over my last 20 years of just being in the boardroom and things being stated, and you're like, wow, you really don't realize there's a whole nother gender out there. So that's not words we want to use, or that's not the type of thinking we want to use. I mean, a good example that really, kind of bothers me in healthcare is there are some sensors, some O2 sensors that just don't work on people of color. Because why? Because when they were developed, the sensor itself was not tested on a wide range of subjects, of people with different skin tones. If you don't have anybody on the board thinking about that, then demanding the CEO to think about that, who then demands his or her product people to think about that, then that's how these things get lost. So in the venture ecosystem, what's happening? If you do not have asset allocators or GPs that are women, that are people of color, making investments in these startup companies, and therefore demanding that they have no bias in their products, then you're going to get a next generation of products, much like what's happened before, that are completely biased and unequitable. So I don't know if you guys knew this, but back in the day, a lot of these camera systems that would recognize you, right? They would not turn on when a person of color would walk by them. Why? Because no one thought, again, to make sure that the ML and AI systems, and that's one thing if it's being used for sort of the surveillance economy and selling me an ad. It is quite another thing when this technology is being used to detect if I have breast cancer, if I have some other condition. This cannot happen when it comes to healthcare. It's too important. So the implications are if you don't have LPs that then demand that the GPs, it's all, as I said, all the way up the chain. The accountability has to be all the way up. It's like the board all the way down to the employees. There has to be diversity. It's the only way we're going to get diversity and no bias inside these products.
Yeah, it has a really great trickle down effect for sure.
Yeah, and I just wanted to add, and I can't remember if there was going to be a time when I could say this. Tara and I, we were going to close our, just close the fund. We've raised, the amount that we need to raise to execute on our strategy. And because of you, Pooja, we realized something is when we were closing, we looked at, we're largely institutionally backed. The fund is, so about 90% of the fund is all institutional money, but we did have a small portion that was individuals. And we were doing some reporting on kind of just the individuals. We were grouping them and sort of noticed, oh geez, of the individuals that have invested in Black Opal, from a capital allocation and point of view, just on the individual side, it's 70% men, 70-80% men, which it's okay in that these are our friends and people we know, but not okay that we are a female-led firm and we're going to really not have 50-50 in terms of individuals investing in our fund, men and women. And really, it's because of you, Pooja, that we looked at this in the first place, Pooja and Patience, and that we decided not to close the fund, even though I have to say, as Cheryl, who I know is on this phone call, knows, we've been fundraising a long time and like to get on with investing, but we decided to actually extend to try to get 50 more women, not more, I should say 50 total women, to invest at least 50K in the fund so that we can have a 50-50 allocation in the individual investments in Black Opal. I think we're at 15 is my count, so we need 35 more women to put in at least 50K. And thank you, Pooja and Patience, for even helping us with that first 15.
Yeah. Thank you, Eileen. Thank you, Tara, for sharing all of that about Black Opal Ventures. We're very avid supporters of you both and the fund. I want to close off the conversation with one last question for you both. It's why we're here today, to invoke moonshot thinking and asking what if. So my last question for you is, what's your moonshot idea? How would you finish the question, what if? What's it going to take to bring about real change?
I can kick that off, and then I'll turn it to Eileen. So my what if is I have in my career sort of seen this divide between sort of the nonprofit world, the legacy industry world, and the entrepreneurship world. And what really gets me up in the morning and gets me excited about the work that we're doing is that what we are finding is that entrepreneurship and innovation and investment are really transforming social issues, not just in healthcare, but in many industries. And so, what if we could actually tap into that even more so than we do now, and bridge that gap between large and legacy organizations, and the innovation and entrepreneurship world that Eileen and I invest in. We think that that's actually going to be the part of the industry that's going to really make change in healthcare and national security and environment. And these are going to be the change makers. And what if we can actually do more of that, but also really bridge that divide that often exists between the startup world and the legacy world?
So my what if is, I'm a big fan of Ursula Burns. Ursula Burns, if you know, she was the CEO of Xerox, and she has this book that I suggest everybody reads. But my what if is, what if we stopped focusing purely on return on investment and the every capital dollar that we put in? So what if one day all of us, when we look at our Fidelity 401k report, it is not just about whether or not we had a high IRR, but what was the impact of the dollars that we invested in these companies? Did we improve gender equality? Did we improve healthcare access? Did we improve, kind of carbon neutrality, or at least environmental effect, reduce the environmental effects of our modern day world? I would love to see that. I think that if we all did that, then the allocation of capital, the allocation of investing, would be for a more equitable world for all of us.
Wonderful. Thank you both. That was such an inspiring and energizing conversation. Thank you for your what ifs as well. At this point, we can turn off the recording, invite everyone